Vision is undoubtedly one of the most important senses you have. Without it, flying an aircraft would be impossible. Vision allows you to see what your airplane is doing and what is happening around you. Even an instrument-rated pilot flying without outside visual references must rely heavily on the visual sense to interpret the instruments and determine how the aircraft is performing. The eyes serve as your visual sensors. Almost everything you perceive about the world around you is based on vision. In good weather, for example, you know that your aircraft is flying straight and level because this is the image which was produced in previous training sessions. When you see another airplane, it is your visual sense that tells your brain where it is and what it's doing. Your reaction is based on the processing of this visual information. There are times, however, when the brain has trouble interpreting what the eye is seeing. For example, do you see a candelabra in this picture? Or two people facing each other? Are the long lines parallel? What do you think now? Is line A or B longer? This program will explain the structure of the eye, along with its limitations, especially those that occur at night. It will also tell you how to compensate for certain illusions that are created during flight. Light reflected or emitted from an object projects an image through the iris and lens of the eye. This light is bent or refracted so that the image is focused on the retina. The retina is made up of very tiny photosensitive cells called rods and cones. The cones are concentrated in the central part of the retina and provide the sharpest image. As the level of illumination decreases, the cones in the central area of vision begin to lose their ability to see clearly. The rods are located primarily in the peripheral area of the retina and are responsible for your peripheral vision. To test your peripheral vision, look at something straight ahead of you. Then, with your arms out to the side of your body, slowly move them forward until you can barely see your hands. At this point, you cannot see the fingers on your hand. This is because the rods cannot distinguish very well. If you turn and look directly at one hand, you see a lot of detail because the cones are now being used. Although rods can't see detail well, they are very sensitive to low light. But it takes time for them to adapt. This fact can be observed when you turn out the lights at night. At first, it's pitch black. Then gradually you begin to see more detail. What you are experiencing is the rods adapting to the available light. 30 minutes generally is required for the eyes to fully adapt. Careless or inadvertent exposure to bright light after your eyes have adapted to the darkness will temporarily impair night vision. The amount of impairment depends on the intensity and duration of the exposure. If the light is bright enough, it could take a full 30 minutes for your eyes to readapt. If it looks like you will be exposed to a bright light and you have time to react, closing one eye will retain the light sensitivity in the closed eye. This allows you to see once the light has disappeared. At night, you need to be able to read the instruments, notes, and maps, and still be able to look out at a black sky and scan for other aircraft. Red cockpit lighting helps maintain your dark adaptation. As with all lights used at night, they should be set as low as possible while still enabling you to see the instruments. Red light, however, impairs your ability to see certain colors. For example, the colored ranges on the instruments, notes written in red, or the magenta colors on a sectional chart are very hard to read. Use of a carefully directed dim white light should be used whenever appropriate. To help you see other aircraft at night, federal regulations specify that all aircraft must be equipped with position lights. They must be on any time the aircraft is operating between sunset and sunrise. The required position lights are a red light on the left wingtip, a green light on the right wingtip, and a white light on the tail. Each light is shielded so it can be seen only from a specific angle. By understanding where the position lights are located, you can determine an aircraft's direction of flight. For example, since you can only see the anti-collision light and the white light on the tail of this aircraft, it is moving in the same direction as you are. This aircraft is approaching head-on because both of the wingtip lights are visible. This one is moving right to left since you can only see the red light on the left wingtip. Scanning the sky at night requires a slight modification to the normal scanning technique because the rods located in the periphery of the retina are more sensitive to light than the cones. During periods of low illumination, a blind spot can develop in the central vision area where a large concentration of cones exists. However, by looking to one side of an object, the rods are exposed to the light and the object becomes more visible. When flying at night, you must be careful to avoid visual illusions which could place you in a dangerous situation. One of these illusions is caused by staring at a single light source, such as a star, against a dark background which is void of any other visual cue. If you stare at it long enough, the light may suddenly appear to move. This is known as the autokinetic phenomenon. If you are not aware of this problem, you might think the light is another aircraft and make abrupt control movements in order to miss it. This could result in an unusual attitude, or at the least, could be very unnerving to any passengers you might have with you. Keeping your eyes moving will eliminate this problem. You should also be aware that the lights you see at night can produce illusions. For example, bright lights appear closer than dim lights. So bright runway lights might make you feel you are closer to the runway than you actually are. This could cause you to begin your descent earlier than you should, creating a dangerously low approach. The opposite illusion could occur if the runway lights are viewed through fog, haze, smoke, or a dirty windshield. Since the lights are less bright, you might delay starting your approach. This could cause you to overshoot the runway. Runway width can also produce a false visual perspective. Suppose this is the night view of a typical 3-degree approach to the runway you normally land on. Now, suppose you're flying into an unfamiliar airport and you see the outline of this runway. Are you on the correct approach angle, above it, or below it? Actually, you would be on the correct approach angle. The difference is that the runway you are familiar with is 150 feet wide, while the unfamiliar runway is only 75 feet wide. Visual illusions are not limited to night flight. Landing illusions occur in daylight as well. The slope of the runway can also give you false visual cues, especially during the approach. For example, here is the visual image created during an approach to a normal flat runway. The side view shows the correct approach angle to the runway. When the slope of the runway changes, the visual image changes as well. Here is the correct approach angle to a downsloped runway. It creates the illusion that you're low. If the approach is flown from a position that makes the runway appear to look normal, your approach angle would be too steep. This situation may produce excessive speed on final approach, an abrupt flare, and a long float before touchdown. The possibility of making a bad landing or of overshooting the runway would be increased. On the other hand, the normal approach angle to an upsloped runway would look like this. It creates the illusion of being too high. Again, if you try to make the image of the runway appear normal, your approach would be dangerously low. The best way to avoid being fooled by a sloping runway is to use approach lighting aids, such as VASI or PAPI, to assist you in flying the correct approach angle. In addition, before landing at any new airport, check the airport facility directory for runway information. This will include the length, width, and if appropriate, the slope of the runway. Checking the contour lines on a sectional chart will also give you an idea about the slope of the surrounding terrain. Closely spaced contour lines indicate steeper terrain. As a pilot, you need your vision to comprehend what is happening around you. But even with perfect sight, problems can still occur. You must understand the limitations of the eye and the illusions that occur, and take the necessary precautions to ensure a safe and enjoyable flight.
When outside references are hidden or obscured by darkness or low visibility, your brain may have trouble comprehending what is actually happening. The confusion that results from the conflict between what you see and what you feel is called spatial disorientation. The best way to overcome the effects of spatial disorientation is to rely on the flight instruments and believe in what they are telling you. But it's not always easy to do, because certain situations produce more conflicting information than others. For example, here is what appears to be the horizon. But a check of the attitude indicator shows that the aircraft is in a bank. The horizon is actually here. As the wings are leveled, you can see how spatial disorientation can be caused by misinterpreting lights on the ground and stars in the sky. Spatial disorientation is not limited to flying at night. It can occur in clear skies when you are flying above a cloud deck. If you maintain a level attitude solely by reference to the cloud tops, you could actually be in a banked attitude. You can see that it's important for you to combine outside visual references with a check of your airplane's attitude instruments. When you fly, you rely heavily on your sight for orientation and balance, but you are continuously receiving input from other senses that can either confirm or conflict with what you see. One of these senses is called the kinesthetic sense. When pressure is applied to your skin, joints, and muscles, nerve impulses provide your brain with a sense of your body's position. A problem with the kinesthetic sense is that your brain has trouble telling the difference between pressures associated with gravity and those created by maneuvering G-loads. Another sense that helps you maintain balance and orientation is the vestibular sense. As you maneuver an airplane, the vestibular organs in your inner ear sense the movement. Your inner ear contains 3 semicircular canals that are roughly aligned with the 3 axes of the airplane. The canal located along the vertical plane senses pitching movements. The canal located along the horizontal plane senses yawing movements. The canal located along the lateral plane senses rolling movements. The 3 semicircular canals are filled with a gel-like fluid that is able to move within each canal. At the base of each canal are small hairs that project into this fluid. When you move your head or maneuver your airplane, the fluid inside the canal is set in motion. This movement causes the sensory hairs to bend. This sends a nerve impulse to your brain, where it is interpreted as movement in a specific direction. When the hairs are not bent, movement is not detected. This can happen when you're at rest or when the fluid stabilizes. For example, after being in a prolonged shallow turn, the fluid in your inner ear catches up to the rest of the ear and the sensory hairs stop bending. This creates the sensation that you have stopped turning. Any change in bank will again set the sensory hairs in motion and further distort your perceived position from your actual flight attitude. This illusion can easily be avoided by frequently cross-checking your airplane's attitude instruments and believing what they tell you. Another type of illusion that can occur during a prolonged constant rate turn is the Coriolis illusion. This illusion can be caused by rapidly tilting your head to change fuel tanks or to pick up an object. This movement starts the sensory hairs in the semicircular canals in motion and can create a false sensation of turning or accelerating. You can avoid Coriolis illusion by using slow, deliberate head movements. Although every pilot is subject to disorientation, it is more likely to occur when you are flying at night or in marginal weather without relying on your flight instruments. By understanding the limitations of your senses and relying on your instruments, you can help to prevent the potential problems caused by spatial disorientation.
Breathing. It's such a natural process that we rarely think of it at all. The respiration process is one of your body's most complex functions. Each breath you take starts a process of exchanging the carbon dioxide in your blood for the oxygen in your lungs. This exchange works well under normal conditions. But when you fly, changes begin to happen in the air you're breathing. Remember in the section on airplane performance when we told you that your airplane doesn't perform as well at high altitude as it does at sea level? Well, the same thing happens to your body. Performance decreases when there is not enough oxygen reaching the cells of your body, and is most significant when flying above 10,000 feet MSL without the use of supplemental oxygen. Depriving your body of oxygen results in a condition known as hypoxia. When there is a lack of oxygen in the air you breathe, a condition called hypoxic hypoxia can occur. Hypoxia can occur very suddenly at high altitudes during a rapid climb or during rapid decompression in a pressurized airplane. The onset of hypoxia can also occur very slowly when you fly at low altitudes for an extended period of time. Let's take a look at a couple of examples of how quickly your body reacts to a lack of oxygen at various altitudes. We'll start with an airplane at 25,000 feet MSL. If the oxygen supply is suddenly lost, you have 3 to 5 minutes to save your life. Within this period, called the time of useful consciousness, the first symptoms of hypoxia begin to occur and may be severe enough to affect rational decision-making. Beyond 5 minutes at this altitude, decision-making is severely limited. Although you may remain conscious, you may be mentally and physically incapacitated. You will lose consciousness after about 9.5 minutes. Now, let's consider what happens during a rapid decompression at 30,000 feet MSL. There is a dramatic reduction in the time of useful consciousness at this altitude. You have about 1 to 2 minutes to make a life-saving decision, such as putting on your oxygen mask. The symptoms of hypoxia vary from one individual to the next, and not everyone experiences the same symptoms at the same altitude. Some of the more common symptoms of hypoxia include a lightheaded or dizzy sensation, headache, sweating, tingling sensation, blue fingernails and lips, a reduced visual field, frequent yawning, impaired judgment, a feeling of euphoria or a false sense of well-being, and changes in personality. However, by the time you recognize the symptoms, it may be too late. The key to preventing hypoxia is the timely use of supplemental oxygen. Recovery from hypoxic hypoxia usually occurs very rapidly when supplemental oxygen is used. Although regulations specify altitudes where supplemental oxygen must be used, you should not rely solely on the altimeter to determine when you need to use it. Certain parts of your body are affected by a lack of oxygen before others. Your eyes, for example, may lose some of their acuity, especially at night. Other factors, such as your physical condition and whether or not you smoke, may reduce the altitude where you should use supplemental oxygen. As a general rule, you should consider using oxygen when you fly above 10,000 feet during the day and 5,000 feet at night. Although high-altitude flying without oxygen is the primary cause of hypoxia, there are other situations that can cause it. When your blood is unable to absorb a sufficient amount of oxygen, a condition called hypemic hypoxia can occur. A major cause of hypemic hypoxia is carbon monoxide poisoning. Carbon monoxide is a colorless, odorless, and tasteless gas and is present in exhaust fumes. Under normal conditions, the oxygen that passes through your lungs attaches to hemoglobin in your bloodstream and is then carried to the cells in your body. Inhaled carbon monoxide attaches itself much more easily to the hemoglobin than does oxygen. In fact, the carbon monoxide may prevent oxygen from attaching itself to the hemoglobin. This results in less oxygen reaching the cells in your body. As you climb to higher altitudes where the air is less dense, you become more susceptible to the effects of hypemic hypoxia. Most light single-engine airplanes are heated by air, which passes over the exhaust manifold. A defective heat exchanger could allow carbon monoxide to enter the cabin. Since it is difficult to tell when carbon monoxide is in the air, you can use a carbon monoxide detector like the one shown here. The dot on the detector changes color to indicate that carbon monoxide is present. If you smell exhaust or suspect that carbon monoxide is entering the cabin, turn off the heater. Open the fresh air vents or windows, and use supplemental oxygen if it is available. The symptoms of hypemic hypoxia are very similar to those of hypoxic hypoxia, but your body may take up to 48 hours to rid itself of the carbon monoxide. Some people believe they can prevent hypoxia by breathing rapidly and deeply to get more oxygen. This technique, called hyperventilation, forces too much carbon dioxide out of the bloodstream, which can be very dangerous. Consciously breathing too deeply and rapidly is not the only way to produce hyperventilation. Stressful situations can also induce it. When you become anxious, tense, apprehensive, fearful, or are overworked, your natural breathing rate may radically increase. Without even being aware of it, your increased breathing rate can lead to hyperventilation. Restoring the proper balance of carbon dioxide in your body will help you overcome the problem. You can do this by slowing your breathing rate and restoring it to normal. Recovery from hyperventilation is quite rapid when this is done. Breathing into a paper sac is a common procedure for overcoming hyperventilation. As you rebreathe exhaled carbon dioxide, you're helping to restore a chemical balance in your blood. Talking out loud or talking to other passengers are also good techniques. It is possible to suffer from hyperventilation, even if you're using supplemental oxygen. Because the symptoms of hyperventilation are similar to hypoxia, you need to evaluate your condition carefully and be aware of those symptoms unique to hyperventilation. Another important physiological consideration is how your ears, sinuses, gastrointestinal tract, and teeth are affected by changes in atmospheric pressure as you climb and descend. Your body contains about 1 quart of air and gas at any given moment. As you climb, the air and gases begin to expand in an attempt to equalize the pressure inside your body with that of the outside air. At 10,000 feet, the air and gases inside your body expand to a volume nearly 50% greater than they were at sea level. As altitude increases, the air continues to expand. At 18,000 feet, the air and gases expand to twice the volume they were at sea level. A gradual climb to altitude will help equalize the pressure and reduce the discomfort caused by the gas expansion. Your ears are the part of your body most commonly affected by changes in pressure. Under normal conditions, the air pressure in your middle ear is equal to the pressure in your ear canal and throat. The eustachian tube that's located between your middle ear and throat is the opening that helps keep this pressure equal. As you climb, the pressure decreases and the air in your middle ear begins to expand as it tries to equalize itself with the outside air pressure. If the eustachian tube is closed, the pressure in your middle ear will continue to build. You will experience pain and possibly a slight hearing loss as the eardrum bulges out toward the ear canal. Yawning is usually a good way to get relief. If this doesn't work, you might have to descend to a lower altitude. Now, let's take a look at what happens during a descent where the opposite condition exists. As you descend, the atmospheric pressure becomes greater than the pressure in your middle ear. Because the eustachian tube opens more easily to let high pressure out than it does to allow air back into your middle ear, your eardrum might be pushed inward by the higher atmospheric pressure in your ear canal. This is what happens when your ears plug. You can usually open the eustachian tube and relieve the pressure built up by yawning, chewing gum, or swallowing. You can also perform the Valsalva technique to relieve the pressure imbalance. This is done by pinching your nose, closing your mouth, and gently blowing air into your nostrils. You might have to perform this technique several times as you descend. When you perform the Valsalva technique, you are opening your eustachian tube by forcing air through it. With the eustachian tube open, the pressure in your middle ear will become equal to the pressure in your ear canal and throat, and your ears will unplug. Changes in altitude can also cause pain in your sinuses, especially if you have allergies or a cold. Although you can normally eliminate the discomfort by performing the Valsalva technique, you might have to fly at lower altitudes. Poor dental care can be another cause of pain while flying if you have trapped air in fillings, damaged root canals, or abscesses. Scuba diving and flying might seem worlds apart, and from a physiological standpoint they should be. You're probably familiar with the term the bends. It describes a diving malady that results from nitrogen that has absorbed into a diver's tissues, coming out of solution and forming bubbles in the bloodstream. Although you might finish a dive well within the no decompression limits, the reduced atmospheric pressure you encounter while flying can cause decompression sickness. You should wait at least 12 hours before flying after a no decompression dive, and at least 24 hours after a dive requiring decompression. As a pilot, you need to understand how your body reacts to variations in altitude. Because the altitude you fly at can result in an insufficient supply of oxygen, you need to know how you can prevent potential problems. You must also understand that as you climb and descend, changes in atmospheric pressure can affect your flying performance.
From time to time, your physician may prescribe a drug to help you fight an illness or to reduce pain and discomfort. You also have thousands of over-the-counter medications that are available to fight a wide variety of ailments. Because of the physical and mental demands of flying, you need to be very careful about mixing drugs and flying. When you're taking medication or not feeling well, you should ask yourself, am I really healthy enough to fly safely? If you're taking medication for any reason, you also need to understand how your body will react to the drug. In most cases, the label will warn you of the potential side effects of the drug, but your best source of information is your aviation medical examiner. If you have any doubt about the effects of a drug, this person will be able to give you the answers. In addition, your personal physician may prescribe a drug without knowing your pilot. Always tell the doctors who treat you that you are a pilot and discuss the potential side effects of the drug before you take it. Let's look briefly at the broad classifications of drugs and some of the problems associated with them. The antihistamines and decongestants that are used to alleviate cold and allergy symptoms often cause drowsiness and slowed motor response. Amphetamines, like those used as appetite suppressants, are potentially dangerous because they can produce restlessness, anxiety, cardiac disturbances, hallucinations, and convulsions. Motion sickness remedies may be very helpful for your passengers in preventing air sickness, but you should not use them yourself. They contain sedatives that can cause drowsiness and decrease your alertness. Common over-the-counter painkillers, such as aspirin, normally produce few side effects when taken in the correct dosage. On the other hand, prescription painkillers, like those used to reduce severe pain, produce side effects that usually preclude flying. These prescription drugs can make you feel dizzy or nauseous, blur your vision, and make flying very dangerous. Another substance that produces a drug-like effect is alcohol. It acts as a central nervous system depressant and can severely affect your judgment and motor skills. Obviously, alcohol and flying do not mix, and federal aviation regulations specify guidelines for pilots. These rules prohibit you from flying for 8 hours after consuming any alcoholic beverage. In addition, your blood alcohol level must also be below 0.04%. Because of the degrading motor and mental responses produced by consuming alcohol, prudent pilots choose to increase the time between the bottle and the throttle. Offenses involving alcohol and drugs can have serious consequences on your flying career and your flight privileges. All of the following can result in the suspension, revocation, or denial of any certificate, rating, or authorization, or the application thereof. Flying while impaired or intoxicated. Knowingly carrying illegal drugs on board an aircraft. Any conviction of a motor vehicle offense involving alcohol or drugs. Failure to report any conviction of operating a motor vehicle while intoxicated, impaired, or under the influence of alcohol or drugs. Federal regulations require all pilots who are convicted of said offenses to file a written report to the FAA Civil Aviation Security Division no later than 60 days after the conviction. Also, be aware that the Department of Transportation audits motor vehicle records to locate pilots with alcohol or drug-related motor vehicle offenses. Nicotine and caffeine are two drugs that are regularly used by many pilots. Although they are not prohibited by regulations, the nicotine found in tobacco and the caffeine contained in coffee, tea, and soda can alter your flying performance. Smoking increases your susceptibility to hypoxia and can damage the delicate bearings in flight instruments. Caffeine may cause extreme nervousness, stomach irritation, and muscle tremors, all of which can reduce your performance. Although modern medicine allows you to continue with many activities when you're feeling under the weather, there can be no compromises when it comes to flight safety. Flying requires a healthy, alert pilot. Knowing your physical limitations and the possible side effects of various medications will help to make you a safe and responsible pilot.